So phase 4 takes it to the next level, beyond just doing normal daily things to getting you back to your sport or activity of choice. And this is more of an optional area, but that moment that a lot of athletes have been patiently waiting for the last 3 months. Phase 4 of the rehab is more of an elective phase and is that step beyond the normal daily activities, going to more of like a recreational or return to sport. And so working with a formal physical therapist is somewhat optional at this point, and some patients will choose to start transitioning working with like an athletic trainer that are more focused on their individual sport that they want to do. But there's a lot of variability here that people can build in, and it's really a chance just to focus on any areas of residual weakness to be able to get you back safely to return to the sport that you want to do. For example, one unique thing about the runners is they tend to run into this imbalance between their hip flexors and their glutes, where their hip flexors will become tight or overused from the running motion, and the glutes tend to be not as strong as they need to be. And that can result in either hip flexor tendonitis or SI joint pain or sacroiliac joint pain. And the key to restoring pain-free motion is really focusing on the glute strength and stretching the front of the hip, making sure those hip muscles are balanced. Another unique population is the dancing population, and these patients will often self-select themselves into dancing because they have large arcs of motion or big ranges of motion, but oftentimes they'll actually lose their strength or muscle control near the ends of their range of motion, and that puts them at risk for injury. And so it's important for them during this 4th stage of their rehab process to make sure that they're maintaining their full strength and muscle control even at the ends of their range of motion. Soccer players, hockey players are these kind of high hip flexion athletes. It's really important for them to strengthen their core muscles to help support high hip flexion demands. Typically, I'll recommend a return to sport at about the 4-month mark for some of those high hip flexion or sports that require a lot of cutting or pivoting.